Hello there, and welcome to another episode of the Hormone Balance Solution podcast. So on this episode, we're going to be talking about mental health in midlife. This is such an important topic. Overall health, of course, extremely important. But if you don't have your mental health dialed in, you're going to find it very, very difficult to do the things necessary to support overall health, right? To eat correctly, to move your body, whatever the case may be. If you don't have your mental health in check, it's going to be hard to find the motivation and the impetus to do these things. But, also there's nothing worse, speaking from experience, than having anxiety or a flat mood. Anxiety is definitely something that I have experienced in the past. I've talked about this before, not so much depression, but I definitely have had anxiety and experienced it. And it is awful, absolutely awful. So I have a real soft spot for women who come to see me in practice who are struggling with their mood, whether it be anxiety, whether it be irritability, whether it be mood swings, whether it be depression or just a low mood. We don't necessarily have to have full-blown clinical depression to be struggling and to have a really low mood. And the reason we're talking about this is because in midlife, for perimenopausal women, it becomes more of a risk. Significantly, it becomes more of a risk because of the variability in our hormones, which we'll get into. But it also, for those of you who have experienced anxiety or depression in the past, or who have had postpartum mood issues, again, anxiety, depression, you can have both postpartum. I had a postpartum anxiety. For those of you who have struggled with PMS or PMDD, you're at more risk as you move through on that perimenopausal transition and journey. You are at more risk of these mental health struggles rearing their head again. So we want to sit up, we want to take notice, and we want to do everything in our power to combat mental health struggles. And the good news is there is so much that we can do that is completely safe, that is completely effective and natural. So there's a lot we can do. So we're going to get into it all. And the other reason I'm really passionate about this is because antidepressants and anti-anxiety drugs are not the solution. Don't get me wrong, I'm not anti-medication. I think there is a time and a place for medication. I think they are a wonderful bridge. I have in the past utilized them myself. So I do think they have a time and a place. Do I think that for women in perimenopause who are starting to, maybe even for the first time ever, experience mood changes, do I think they are the best first line strategy? Absolutely not. And I think that it is very much letting women down. These doctors who don't understand perimenopause, who don't understand it can last for 10 plus years, who don't understand the transition can start even as early as your 30s. For those doctors who don't understand hormones, I think that they are really letting women down by suggesting an SSRI or an anti-anxiety medication as the first line strategy, because it doesn't have to be that way. And these drugs can have some very, very serious problematic side effects. We do not want to be taking medications if we don't have to. That's important to know. And it pees me off because there is a very, very safe and very, very effective and very, very natural solution to a lot of midlife mental health struggles. And that's called bioidentical hormone replacement therapy. So we're going to get into it. So if you are somebody struggling, if you all of a sudden have anxiety, for example, this can very much be because if you're in midlife or you're in your mid to late 30s, even especially in your 40s, this can very much be due to the changes in hormones. And so, like I said before, perimenopause can last up to 10 years. So this is something that, perimenopause doesn't just happen in a day or a week or a couple of months. For some people, it can be a long and bumpy ride. So we need to listen up now, and we need to start to implement things right away so that we can have a much smoother journey through perimenopause. So it's the decline of hormones combined with the fluctuation of hormones that can contribute to the mental health symptoms. So, for example, as progesterone starts to decline in our perimenopausal years, our anxiety can ramp up. And this is because progesterone is a very calming, very soothing hormone. Progesterone also helps us get to sleep. So if you've noticed an uptick in anxiety, or maybe new anxiety you've never had any before, and or maybe you've noticed that your sleep is struggling, you can't get to sleep, and you think you're in that perimenopausal transition, then progesterone may be the ticket, maybe just what you need. And yes, it can actually be that simple sometimes. Sometimes. It's not to say you can't do all the other things, shouldn't do all the other things, which we'll get into, the foundational work. But I have seen progesterone completely change women's lives, completely change their lives. They're sleeping better, no more panic attacks, no more heart palpitations, no more anxiety. I've seen women come off anti-anxiety meds, antidepressant meds, because they introduced natural bioidentical progesterone. How do you do that? Well, that's what my course is for, HRT Made Simple. That goes into all the hows and what kind, what form, and what to do if you have a reaction. And it's all covered in that course. And of course, all that information will be going in the show notes. But progesterone will start to decline because we get this stop-start ovulation. And ovulation is how we make progesterone. So as we're going through perimenopause, our ovaries are slowly shutting down. And so we're getting this stop-start ovulation. And if we don't ovulate 1 month, our symptoms may be a lot worse than if we maybe ovulate the next month and we feel more calm and we think, what's going on with me? Last month I was a nutcase. It might be because you're having this stop-start ovulation. So look for symptoms when it comes to low progesterone, look for symptoms like water retention, mood swings, PMS, anxiety, inability to get to sleep, tender breasts. Those are some of the big ones. Now, it's not just this low progesterone or this lowering progesterone. Estrogen plays a huge role when it comes to mental health. And by the way, progesterone and estrogen, they support the HPA axis. They support our ability to be resilient. They support our stress tolerance. And so a lot of women moving along in their midlife journey realize they just can't respond to stress like they used to. They're more irritable, they're more snappy, they're more overwhelmed. And this can in part have to do with the erratic nature of your hormones, or the lowering hormones. And so you're not getting the support of these hormones, which can support your adrenals, your HPA axis, your stress resilience, your stress response. So replacing those hormones is one strategy that can really support your ability to cope with stress, which impacts your mental health. But what we do know from the research is that it's this variability in estrogen that can really impact our moods. And so it's in perimenopause, we get this up, down estrogen. And that's in part because, again, the ovaries are shutting down their production, but the brain recognizes this. And so the brain yells at the ovaries and says, what are you doing? We don't have enough of the good stuff. And so the ovaries shoot out some estrogen. So it goes up real high. But then what goes up must come down. So then we get these dips, and then the brain screams again at the ovaries, and they're like, oh, sorry, here we go, here's some more. So it's up, down is what's happening with our estrogen. And that variability has a real impact on our mood. Estrogen also goes hand in hand with serotonin. They're kind of BFFs. And so when you are struggling with your estrogen levels, it could absolutely influence the production and the function of serotonin. And I think everybody really knows one of the roles of serotonin is it's a happiness neurotransmitter, right? It can really help us to be happy. So you want to have enough estrogen to support the production of serotonin, and to even support the number of serotonin receptors in the brain. Estrogen will help with that. And so, yeah, this variability of this estrogen can really impact our mood. So we got it. And so I guess the question is, well, what can you do about that? Right? Is there anything you can do about that? Yes, there is. And again, the answer may lie in hormone replacement therapy for you. So if you bring on board some estrogen, you can potentially quiet that screaming of the brain to the ovaries. So you've brought in your progesterone, you've got your nice, soothing, calming progesterone, you're getting to sleep well, but maybe you're still weepy, maybe you're still irritable, maybe you're depressed, maybe you've got a low mood, maybe you're waking in the middle of the night because estrogen helps us to stay asleep. Maybe you've got some of these symptoms of low estrogen. So maybe then what you're going to do is bring on a little bit of estrogen, and it's going to calm those peaks and create more of a sense of calm and a better mood for you. And just by the by, these fluctuations can also increase your chance of getting migraine headaches around your cycle. And so something that can be very effective is bringing on board that estrogen. And it's helped me to smooth out those migraines and to actually eliminate them, which is really great. Okay, so what else can we do? So HRT is super duper important. If to consider maybe that's what you need. And again, like there's so many things to consider with HRT. That's why I put the course together. So go grab the course to find out more. But do not forget all the foundational work. You cannot expect, maybe you don't need HRT. Maybe you're not eating the best diet. Maybe you're a bit inflamed, right? Maybe for you, you need to do all the foundational work first and see how you respond and react before bringing on HRT. So it's impossible for me to say because I don't know you, I don't know anything about you. But regardless of the HRT, whether you do it or not, and I will say though, as a caveat, those of you who are really struggling mentally, and let's say, you're in your 40s and you've really come up and it's unique, it hasn't been happening for decades, you've come up alongside some really bad anxiety or panic, you may not want to waste time. You may want to, because these hormones are so effective and so safe, and they start to decline in our 20s, that by the time you're in your mid-40s, if you're struggling with your mood or you're struggling with anxiety in particular, a first-line strategy the doctor might say is have an antidepressant or anti-anxiety. And I'm encouraging you to say, no, thank you. I would like to first try bioidentical hormone replacement therapy. So regardless of whether you're on a HRT, you're not, you're going to be, it doesn't matter. You have to have the right foundation. So let's just quickly address what those foundations are. Diet is always a foundation. It's absolutely fundamental. So you need to kick the processed foods. You need to kick the inflammatory oils, vegetable oils, right? Seed oils, all those industrial oils. You want to kick them out of your diet. You want to eat out less, because when you eat out, you're not going to be having the most fresh, usually, organic foods, and you're going to be exposed to these shelf-stable inflammatory oils. So make sure you're having a whole foods diet, lots of protein, minimum 100 grams a day. And then you want to have tons and tons of vegetables. You want to have some fruits, polyphenols, berries every single day. Have you had your polyphenols? Blue, black, purple foods, crucially important. So the diet's really important. Kick the alcohol. If you're struggling with your mental health, eliminate alcohol. If you're struggling with anxiety, eliminate coffee. Eliminate sugar, right? Maybe have some sugar-free treats. Like if you need to if you're in a bit of a habit with your sugar, then go ahead and grab yourself some maybe stevia treats if you need to sort of bridge that gap whilst you're trying to get off the sugar. But eating enough protein and filling up with protein and produce is going to go a long way to kicking sugar cravings. So we're kicking processed foods, we're kicking inflammatory oils, we're upping our vegetable and fruit intake, making sure we're eating enough protein, kicking alcohol, maybe coffee. That's first step, diet. The other thing that's crucially important, and that most women do not do, and most women do not want to do, and it is a real struggle, but it is fundamental, is supporting the nervous system. If you refuse to do this and you never take time out of your day to deep breathe or meditate, you will continue to struggle physically and mentally. So choose what works for you. So me personally, I try to do a 40-minute meditation every day. I don't always get it in, but I definitely aim for it daily. And then sometimes I'll even do another 15 odd minutes of deep breathing. I like to do it in the bath when I've got the tap running. I'll put tons of salts in the bath and essential oils. I'll put some meditative music on and a timer for about 15 odd minutes or 20 minutes sometimes. And I just sit there and I do breath work, very simple. In through the nose for 4, hold for 4, out through the mouth for 7 or 8. It's very simple. It's completely free. Everybody can do it. And that automatically tells your nervous system that you are safe, because you would not breathe like that if you are in a stressed out position, whether it's arguing with somebody, whether it's you're working and maybe you love your work, but maybe you hold your breath a bit when you work, or you're a bit overwhelmed with the kids, whatever the case may be, you're not breathing deeply. But as soon as you start to breathe deeply, your brain gets tricked, and that's okay, into thinking, even if you don't feel completely relaxed, your brain thinks you are. And the more you do it, the more relaxed you will become. But don't think 2 minutes whilst you're just driving to pick the kids up is going to cut it, because it's not. And what I tell my ladies is, you may be doing 0 right now, so start at 5 minutes a day. But ultimately, I believe we should all be doing at least an hour a day of breath work or meditation. And look, there are other things too that support the nervous system. Heart math, journaling, and walking outside is wonderful. But if you're walking outside and you're on the phone or you're on social media or your brain is thinking about things, you're not getting those benefits. You're still in fight or flight. So you actually have to be very proactive, and you actually have to close your eyes, put on some meditative music, and switch that brain off and get into that rest and digest mode. So that's crucially important. So diet and lifestyle. Exercise is a must. If you're struggling with your mental health and you're not exercising, you're not doing the foundations. You don't have to push yourself. Crazy cardio, especially in midlife, is probably not the answer. Just walking is a good place to start. If you're not doing anything yet, get out there and start to walk 30 minutes a day. Outside in nature will do wonders for your mental health. And then in time, start to incorporate the weightlifting, which I talk about a lot and a lot and a lot. So those are really the things to think about if there's mental health issues. And I want to encourage you, because there is absolute hope. There is hope. You might need support though. It might be hard to go it along alone, especially if you're really struggling. It is going to be hard. So if you want my team and my support, of course, you can always reach out to me on Instagram at Tara Thorne Health. DM me. We can have a little chit chat about what's going on and how we may be able to help you. I have links in the show notes to ways that you can get in touch, to the Hormone Balance Solution as well. Check that out. And, you may want to start with the HRT course if I've piqued your interest there and you're thinking you might need to become educated and informed so you can have a really good conversation with your doctor, because that really could change your life. So all that information is in the show notes. So if you are feeling hopeless, weepy, irritable, PMSy, anxious, you got an underlying feeling of impending sense of doom, maybe when you wake up, unmotivated, if you have an inability to focus, to concentrate, all of these symptoms are overcomable. There are answers, there are solutions. Don't give up on yourself. Reach out if you need help. And I really hope that you enjoyed this episode of the Hormone Balance Solution podcast. We'll speak to you again soon. Bye for now. I am not a medical professional, and the information provided in this podcast is for informational and entertainment purposes only. I do not have access to your individual medical history or circumstances, so the content discussed here should not be considered as medical advice. Before making any changes to your diet, lifestyle, or considering the use of supplements, please consult with a qualified healthcare professional or your doctor to ensure it's safe and appropriate for your specific situation. Any decisions you make based on the content of this podcast are at your own discretion and risk. Thank you for tuning in.